Today we're going to talk about the MARA appliance, which stands for Mandibular Anterior Repositioning Appliance. The reason you would need a MARA is if your lower jaw is smaller than the upper jaw. So when you're growing, we can help that jaw almost like peer pressure it to come forward, and we're able to help that become more balanced with the top jaw and the bottom jaw. The MARA has an expander that comes with it. So the expander, most people that have a smaller lower jaw also have a narrow, skinny upper jaw. So we want to widen that upper jaw out so then we have room to bring the lower jaw forward. So this is what the expander looks like, and it glues in on your teeth, and then the MARA is going to have these little arms on the side, on both sides. What this does is it engages with a piece on the lower. This little piece, when you bite down, it hits right on top of those little balls on the bottom piece, and it slides that jaw forward. So we're artificially bringing that jaw in a more forward motion. And then there's a combination of teeth changes, growth, and changes up in your TMJ that help us to get that lower jaw to come forward. As you come in to get it advanced, we put these little tiny shims on there, which is like a little spacer, and we slowly advance that jaw forward. So kind of like if you think about a car, you don't want to go from 0 to 60 in 3 seconds. We're going to gently go from 0 to 20, and then 20 to 30, 30 to 40, and so on, to help that jaw come forward. Normally, when someone needs a MARA appliance, this needs to be done during the peak of the teenager adolescent growth. This is an x-ray of a girl that came in when she was 9 years old, and you can see the excessive overbite here. So we know that upper jaw is a little bit more forward, the lower jaw is a little bit farther back, and looking at the bones in her neck, we can tell that she still has growth potential left. So this makes her a great candidate for the MARA appliance because we know that she is going to grow. So this is an example of what a profile looks like for somebody that has a smaller lower jaw. So you can see the upper lip looks more full and almost forward, a little protrusive. The lower jaw looks farther back. This is a progress x-ray, what it would look like while the MARA is in. You can see the white looking area around the teeth, which shows the appliance in the mouth. The braces are not on yet, and you can see already that we have a great change in the way that the jaws relate to one another. Once the MARA appliance is done and the braces are done, this is an example of what you can expect to see with the profile change. The lower jaw has come forward, the upper jaw has come back, and we have a nice balanced lip profile and a nice balanced skeletal profile from the side. This is a final x-ray after the braces and the MARA have been removed. And you can see, looking at this, now the jaws are in harmony, top and bottom. The teeth are also in harmony, and they have that nice angulation to them, not too flared or bucked out, not too far back. This is what we're going for to try to avoid having jaw surgery in the future. So when you're young and when you're growing, if we can use one of these, what we call a class 2 corrector, to correct that smaller lower jaw, we're trying to avoid extraction of teeth, and we are trying to avoid having to go through a jaw surgery as an adult in the future. This is something that's best done. It depends on the person. So we have kids as young as 9 and 10 that are kind of starting to show those growth signs. We also have kids that are a little older, 12, 13, 14. And it also depends if you're a girl or a boy, because as we know, girls tend to grow a little bit faster than boys do. But this works really, really well for most people to help that lower jaw come forward.